You know that by washing your hands with soap and water or using alcohol-based hand rubs kills viruses that may be on your hands. But do you think by doing this alone helps avoid you from getting the COVID-19 infection? Hi, my name is Errol, and I will explain to you how movement control, social distancing, and quarantine can help you avoid the COVID-19 disease and tremendously help your healthcare provider in handling this pandemic condition more efficiently. Okay, let's understand how COVID-19 is passed from one to another. Here's a group of people. Let's call them A, B, C, and D. Now A is a COVID-19 carrier and he is easy to detect. A goes out and about to meet C. Along the way, A had contact with B at a store or a coffee shop or a mall, a market, or the office, supermarket, anywhere. Now A and B doesn't know each other, stranger to one another. A reaches his destination where he meets with C. C is easy to detect. He may be your family member, a friend, a colleague, a neighbor, a cashier at your favorite store, food delivery service, anybody you know. Once A and C is detected, he is being quarantined. But what of B? B is unaware that he's infected. He is unknown and he's undetectable. Now let's look at D. A healthy person goes to a public area, had contact with B at a store or a coffee shop or a mall or a market, the office, supermarket. Now D becomes a B too, unaware that he's infected, is unknown and undetectable. The objective of movement control, social distancing, and quarantine is to identify person B. So let's say B stays home and quarantine himself. The incubation period is estimated to be 14 days. B will start to show symptoms of the disease like fever, cough, and shortness of breath within the 14 days. This is when your healthcare provider can identify and help to start treatment for B. Without the movement control, social distancing, and quarantine, B will continue to be out there and infecting the D. Now that is why it is important, whether you're a B or a D, to stay at home and quarantine yourself. Stay home, stay safe. If you develop fever, cough, and difficulty of breathing, seek medical advice promptly, as this may be due to a respiratory infection or other serious condition. Be truthful to your healthcare provider. Inform them of your recent activities, your recent travels, the recent places you visited, and the people you had contact with. So remember, stay home, stay safe, and take care. I'm Errol from Reviews for Mums, signing out.